Administration of broad-spectrum antibiotics. In this video, I'll demonstrate how to safely prepare and administer a broad-spectrum IV antibiotics for a postpartum woman being treated for maternal sepsis. Broad-spectrum antibiotics are used for bacterial infections. In the case of sepsis, it can simultaneously treat infection in multiple areas of the body, including the respiratory system, skin, ear, nose and throat, and reproductive organs. Antibiotics do not work on viruses. Section 1. Preparation of equipment. First, I gather all necessary equipment. For an IV antibiotic, I need trolley cleaned with alcohol swabs, tray cleaned with alcohol swab as well, antibiotic. Be sure to check for the expiry date. Sterile water for reconstitution, gallipot with swabs, 10 ml syringes for reconstitution and 5 ml syringe for the saline flush, patient charts, and medical administration record. Safety box. Section 2. Safety checks. I obtain the woman's consent, after which I perform hand hygiene and don my gloves. Before preparing the drug, I confirm the right drug, right dose, and right patient. I also confirm this patient is diagnosed with suspected or confirmed maternal sepsis, and antibiotic is part of her combination therapy, possibly IV azithromycin, ceftriaxone, and metronidazole. Section 3. Drug preparation. I will start by preparing the saline flush using the 5 ml syringe to withdraw the sterile water for injection. Expel all air bubbles within the syringe. I remove the lid from the antibiotic vial and clean it with alcohol swab. I then draw up the recommended amount of sterile water into the syringe. Make sure to refer to the drug information leaflet for specific reconstitution instructions, such as the type and volume of dilutant. In this case, we will use 10 ml of water for injection. I now reconstitute the antibiotic in a vial with sterile water, gently swirling to dissolve the powder completely. I then withdraw the solution back into the syringe, set it on the tray, and move items closer to the patient. Depending on local protocol and resources, the drug can be given as a slow IV infusion in 250 ml of normal saline over 60 minutes, or as a slow IV push over at least 3 to 5 minutes. Section 4. Drug administration. I change gloves to a fresh pair before commencing drug administration. I clean the cap on the cannula with an alcohol swab and begin by flushing the cannula with the saline flush to ensure it is clean and patent. I then commence antibiotic administration slowly over at least 3 minutes, monitoring closely for signs of hypersensitivity, nausea, flushing, or chest tightness, and pain or swelling at the IV site. Section 5. Documentation and monitoring. Once the dose is complete, I document the time, dose, route, and patient response. I also note any adverse reactions. I monitor the patient's vital signs regularly using the Mills chart.